You are now listening to On One Radio, the talk show podcast station. This is your news alert. I am your host, Tony Williams. And welcome to all the new listeners and all of my On Ones Day Ones. Okay, so I've got a health alert for you guys. And with everybody's getting sick around this time, some became sick months ago and others are just now getting sick, and those who are getting sick are trying to heal those that are sick. And we all know how it starts typically. You got kids going to school and friends and teachers, and it just spreads like wildfire. Well, there's a report here about antibiotic resistant infections killing twice as many Americans as once first thought. Now, it does bring a certain awareness, and it heightens the physical security, basically. And what I mean by that is it puts your ass on high alert. Nearly twice as many people are dying in the United States from antibiotic-resistant infections than previously believed. U.S. health officials stated that the so-called superbugs alarm experts with their rate of growth and spread. So we are really actually dealing with something very important here. And we do have to keep in mind the babies and the elderly. They don't heal so well. When they get sick, they get sick. Now, issuing its first comprehensive report into the growing health threat in 6 years, the U.S. Centers for Disease Control and Prevention said it had determined that 2.8 million antibiotic-resistant infections occur each year, killing 35,000 people. Alarming, right? A 2013 CDC study estimated that 2 million Americans were infected by superbugs each year, leading to at least 23,000 deaths. Now, that was in the 2013 report, and it propelled the nation toward critical action and investments against antibiotic resistance. Now, today's report demonstrates notable progress, yet the threat is still real. Now, global health officials have repeatedly warned about the rise of bacteria and other microbes that are resistant to most available drugs, raising the specter of untreatable infectious diseases that could spread rapidly. That is a scary thought, which means as a person, head of household, all of that, you have to be on high alert, washing your hands consistent, just, I don't want to say be a germaphobe, because that's a challenge there. But just stay on high alert, because most people can't afford to get sick and take off of work, and you may be the one to bring this to your household and spread it. And when it's a child or an elder, it really takes a toll. So we really have to be vigilant in making sure that we make sure our homes, cars, even when we go to work, as hard as that may sound, but even when we go to work, keep that hand sanitizer. If you notice somebody coughing and going on, ask them to, you notice they're not covering their mouth, please don't hesitate to ask them to please cover their mouths, because it is the best for everyone. Wear a mask. If you have a cough, you know you're sick, wear a mask. A lot of people are not doing that, which aids in spreading these diseases. And clearly they're having a hard enough time trying to make sure they have drugs available to handle these. So as everyday citizens, we really have to do our part as well. It's just a part of trying to be healthy, remain healthy, especially maintaining a healthy environment. And that's a part of it. Now, drug resistance is also driven by the misuse and overuse of antibiotics and other medications, which encourages bacteria to evolve to survive by finding new ways to beat the medicines. I mean, that's true. That's really how life works. It's about survival. Now, the CDC said that 2019's higher numbers were the result of new and better data sources, not a rise in facilities, and that in fact prevention efforts has decreased deaths from the hard to kill germs by 18%. There's no doubt that drug resistant infections are on the rise. While CDC's estimate has improved, they remain conservative. Solving antibiotic resistance will require ending the rampant overuse of these drugs in livestock. Until then, these life-saving drugs will increasingly fail when sick people need them. And as CDC recognized, everyone is at risk. The NRDC said nearly two-thirds of antibiotics important for human medicine are sold for use in livestock, distributed in mass in feed or water, often to animals that are not sick. The CDC also stated that the antibiotic resistance threat list now contains 18 germs, including 2 more than were considered urgent. Drug-resistant Candida auris. These urgent threats were identified in the 2013 report. Now, we really have to be careful. We do. And that's further proof that there's more antibiotics being put in our food. So when people do get sick and actually need those medications, they're not going to do anything because it's in the food. So this has been your news alert. Everyone be careful, be safe, be vigilant with your health. Please eat more vegetables. Love yourselves, protect yourselves and your families. Thank you for tuning in. You have been listening to On One Radio, the talk show podcast station, and I have been your host, Tony Williams, and this has been your health alert and news. Until next time, have a great afternoon.